said, as a representative of the people, once these allegations came to the fore, I made a point to come here immediately to establish the position of the leadership of Kenyatta National Hospital. I must say that this is a matter that is a great matter, the allegation. Of course, it must be proven, but it's something that I am personally taking seriously. I think with the seriousness it deserves. I've had an opportunity to sit down with the CEO together with the leadership of the hospital, and I've had their side, which is what has been communicated in the press statement, and I'm glad because I actually urged them in the spirit of openness to be able to open the CCTV footage which exists for 1 month. I think they record at least a month long of footage for both the media and the DCI to be able to look at. I think in as much as we may be confident of our internal security provisions, I think despite that confidence, it's something that still must be taken very seriously, and we should open up the place for investigation, because there might be an incident that maybe has not been made, been brought forward to the leadership of this institution. I think it's on us, and despite the great work that the doctors do in this hospital, to make sure that every Kenyan citizen who comes here for medical assistance can feel secure and can know that we have guaranteed that they are safe and secure as they come to seek medical help. And possibly this situation is going to help, improve those areas that I think need improvement. I think we all know the state in which Kenyatta National Hospital is, but we also appreciate the improvement that has been made over the past few months in this institution. So after discussing with them, I'm going to go to the wards to talk to one or two of, to some of the women there to hear their stories. And I'd like to tell the Kenyans who have those complaints, you understand the challenges that come with anonymity of social media, that if they feel that they're intimidated in bringing those claims or those issues to Kenyatta Hospital, that they can bring them to my office. And I'll be able to talk to each and every one of them. They can be able to send them either on email, because I've seen a lot of those on social media, bring them physically to KSCC 26th floor, because this is a matter that we want to get to the bottom of. I'm sure, and I'm glad the CEO has said that she's speaking not just as CEO, but also as a woman and as a mother. And I don't think that, I hate to think that there would be anybody in leadership or administration of a national institution like this who would be insensitive, whether they're a man or a woman, to such an allegation. So I'm glad that the DCI has been asked to come in to investigate, to get witness reports. Those who feel that they're afraid of intimidation, I think Fanda Romundi has said that they feel they still need to get services here. My office is open, and I can even give a line that they can contact and can send a message, and I will be able to follow it up. My personal number, 0721 326070. That is my personal line. So if anybody has any such complaint, please let me know, and we'll get to the bottom of this together. So I think we should not escalate any alarm. I've had people who want to storm the place, etc. It's important to establish facts before taking any action. But we do hope that, Madam CEO and your team, that I think the focus that is now on Kenyatta will give the impetus to improve some of these situations. If a child is in first floor and the newborn unit can be brought closer if it's possible. I know there are issues of machinery, etc. for the incubation, but if it's possible to just improve the state that our people are going through, and those requests that you might have, you can let us know. Maybe it is a funding issue.
Well, that is the chairman of the Health Committee of Senate, Johnston Sakaja, who is also the senator for Nairobi, addressing members of the media into the saga that has befallen the Kenyatta National Hospital, following reports that the media did get indicating that some of the pregnant women who had delivered at the hospital were allegedly being raped by various staff at that particular hospital. And the Kenyatta National Hospital CEO, Dr. Lily Koros, has come out denying these allegations, saying that they aren't true, and she has also called on Kenyans to avoid putting things out of context. And one other thing is that Sakaja has indicated that the Director of Criminal Investigations will be taking up the matter, and investigations will be conducted into this particular issue. Well, we want to go for